comes to beating heart disease, you know, it's really a conversation that we need to have, and change can actually be the cure. February is National Heart Month, and Go Red for Women is about much more than just wearing red. It is about making a change.
That's right, and we've invited some survivors to help us get the conversation started. Darren Lesort and Alexa Stewart are joining us now in the at-home living room to talk about heart health. And the first thing I notice when I look at both of you is that you seem too young to be dealing with these issues, but of course, my own father died from a heart attack at 43. Alexa, why don't we start with you? Tell us your story. What happened?
I was born with the aortic heart valve defect, so I knew eventually when I was an old woman, I was going to have a pig valve. So that's kind of how, like, was our joke around the house that when I was old. I was very active. I ran. That was my thing. I got pregnant and had a beautiful little boy. Life was great. I was teaching kindergarten. I went in
no complications at all.
No complications.
Wow.
The easiest pregnancy of delivery was perfect, picture perfect, breastfeeding, everything was great. And I went back in for a checkup, and the doctor said, your aorta is dilating. And that means instantly you need to get a graft. And then they'll go ahead and fix the pig valve. I fought to start my new kindergarten class. I did. I went in for surgery. I bled out in ICU. I suffered a small stroke. I ended up with a pacemaker. And then about a year later, I had pacemaker-induced heart failures. They went back and upgraded the pacemaker. But what woman doesn't want to be upgraded? Of course, right? So here I am with a beautiful scar to say how feisty I am.
And you know, you threw out a bunch of big words in there, the pacemaker and stuff like that. What was it like every time you got ready for a surgery, knowing what I mean, am I going to wake up from this? This is a big deal.
I think I was so feisty because you have a son at home that you don't even, that's not an option. Like, that's not an option.
Gave me chills.
It's how fast can you get back out there?
Wow.
So awareness is just so important. And Darren, your story is very different. It wasn't something you were born with. It was something that was stress related, right?
Right.
Tell us your story, because I think that's something that people can really, really associate with.
Well, I had a very stressful existence since my early days, but certainly 100-hour weeks, traveling 9 months out of the year, so a lot of it was job-related for about the last 20 years. When I was 40 years old, I was actually working in Las Vegas, morning, going to a breakfast meeting, and I had a very stressful piece of news given to me, and that piece of news caused my heart attack at that very moment.
Wow.
So I had all the symptoms. I knew, I think, had about 7 symptoms. I knew what those were, but I was still in total denial because I've been working out harder and longer than anybody I know. I've never weighed more than I weigh right now. I knew that I was in great health. So when I was having my heart attack and my friends were trying to convince me to get help, I was saying, I'm 40 years old, I'm in the best shape of my life, I'm not having a heart attack. And so what I learned is when people are saying they're not having a heart attack, they probably are.
Right.
But it was clear to everybody around me except me. I was sweating profusely, literally sweat dripping off my nose, my ears, every follicle of hair on my head. I couldn't breathe, I couldn't talk, I was disoriented, I was nauseous, and I had crushing pain in my chest. And ultimately what kind of convinced me to call the ambulance is that my left hand had fallen asleep. So the only thing I didn't have that was textbook is I didn't have radiating pain down my left arm, but my left hand had fallen asleep. I didn't really notice it because of all the pain in my chest, but I was finally at that moment of, what do I do when I can't accept more pain? And I've had all kinds of injuries in my life, and I've had a lot of pain. I've never asked myself that question before. What do I do when I can't accept more pain? My chest hurts so badly. And at that point, I had my best friend, who happens to be a Navy SEAL, has some medical training there with me, which was strange that he was there. But he was the one who finally convinced me that it was okay to ask for help, because I just never asked for help. That's how I've lived my entire life. And to call an ambulance is asking for help. Right. So it was a tough deal. Ended up going into surgery and got a stent, and was in ICU for about 6 days and lived. And it's strange to be able to say that I'm only here because, like Alexa, because of medical technology.
Wow.
I mean, 100% unequivocally would be dead if it weren't for medical technology and a lot of the research that the American Heart Association funds.
Yeah. Well, and I think about what would have happened if you had been at home and not around other people to convince you that you did need to call for help, because I always hear that denial is one of the things that leads to death when people have heart attacks.
I would be dead.
A lot of people think that it's a panic attack, right? That they're having an anxiety attack.
And so that's what happened. I had 2 friends. I had my Navy SEAL friend friend George, and I had my other friend Craig, who's a business owner and has had panic attacks. One was telling me to call an ambulance. The other, at this restaurant in the Venetian Hotel in Las Vegas, was telling me, "Oh, you're just having a panic attack. It's
like,
okay,
take deep breaths."
And you don't want to make a big scene,
right.
you know?
Right, and I didn't want to make a big scene. I had a meeting, so I met them for breakfast. I had a meeting right after that I was preparing for. So I had every reason not to do something. But my friend George he called me in my hotel room. I was preparing for the meeting. He said, "Just come to breakfast. Just come to breakfast." And I didn't want to because I was preparing for this meeting. Had I stayed in my hotel room, I would have died. There is no doubt I would have sucked it up and just died because I couldn't believe that I was having a heart attack of all the people.
I can't believe it can just come on like that with no warning signs whatsoever, and be in perfect health and young, and that is so scary, and especially scary for women.
Yeah, and we'll talk about that when we come back. We'll continue the conversation with these survivors after the break. Plus, we've got a cardiologist joining us later on to talk about some heart healthy things you need to know about, some exercise. We've got some recipes, so come on back.